Welcome to part 2 of the Alabama FAQ. So we just talked about technicians. We're on faxing prescriptions. So can prescription orders be transmitted by fax in Alabama? So all non-controlled substances in Schedules 3, 4, and 5 prescriptions may be transmitted via fax. Schedule 2 medications may not be faxed unless the patient is under hospice care or a long-term care facility. Licensing for pharmacists. How soon must How soon must you notify the ALBOP with change of employment? You must notify ALBOP within 10 days of the change of employment. How often must a pharmacist renew their license? You must renew biennially or on even-numbered years. The license will expire on December 31st of that year. So 2020 is when a pharmacist needs to renew their license. So how many continuing education hours must a pharmacist obtain each year? A pharmacist will obtain 15 ACPE approved credit hours, requiring 3 of those hours to be live. That's each year. What's important there is that by the time you renew, you would have 30 hours total of CE, 6 of those being live at least. So how often must a pharmacist technician renew their license? They must renew on odd numbered years. Okay, so how many continuing education hours must a pharmacy technician obtain each year? Technician obtains 3, annually requiring 1 to be live. So if a pharmacist completes more than 15 hours in 1 year, can extra hours be carried over to the next year to use? Yes. Up to 12 CEs can be carried over to the next year, but once carried over, they cannot count towards live hours, regardless of whether or not they were completed live at the time. So you need 15, you can carry over 12, but you still have to get 3 more live, no matter what. Alright, so some compounding FAQs. If I'm a retail or independent pharmacy and conduct non-sterile compounding, are there additional rules and regulations I must abide by? Yes, of course. That's the USB 795. So can a pharmacist compound a preparation using all over-the-counter drugs and sell the compounded preparation without a prescription? So, a pharmacy may prepare a compounded drug product to be sold over-the-counter without a prescription order. The product shall not contain any ingredient that exceeds recommended strength and dosages for over-the-counter drugs. The finished product shall not be one for which a prescription is required. It shall be properly labeled with the product's name, directions for use, list of active ingredients, and any necessary warnings. A compounded product shall be sold directly to the consumer after professional interaction or consultation between the pharmacist and the consumer. The product may be prepared in advance in reasonable amounts in anticipation of estimated needs. The product shall be stored within the prescription department. The product may not be sold in bulk to other pharmacies or vendors for resale. Alright, next section is your prescribing, our prescribers treating family members and self. And you probably definitely will get a question on this thing. So, under what circumstances can physicians treat themselves or members of their immediate families? Physicians generally should not treat themselves or members of their immediate families except emergency situations or isolated settings where there is no other qualified physician available and only until another physician becomes available. Prescribing or dispensing a controlled substance to oneself or to one's spouse, child, or parent is not allowed unless such prescribing or dispensing is necessitated by emergency or other exceptional circumstances. So what is the process for pharmacists if they suspect a physician is writing prescriptions for a family member or themselves? The pharmacist should contact the Board of Medical Examiners if they experience physicians writing controlled substances to family members or especially to themselves. It can avert future problems for the physician who is simply acting out of ignorance, or be the catalyst to help for an impairment issue. So prescriptions of non-controlled substances. What must be included in the context of the prescription? Alabama pharmacy law does not designate fully what must be included on a prescription. We have used information found in the Code of Federal Regulations, Title 12, Part 1300, which refers primarily to controlled drugs. Alabama law does require that there be 2 signature lines on each prescription. Federal regulations state that prescriptions should include the name and address of the patient, name, address, and DEA number of the prescriber, name, strength, dosage form, quantity of the drug prescribed, directions for use, number of refills, signature of the practitioner. A prescription may only include 1 page and may not be multiple pages with a signature at the end. A prescription should be for 1 patient as well. Weight loss medications. FAQ, according to ALBOP, may a physician prescribe a Schedule II controlled substance for patients for the purpose of weight reduction? No. May a physician or agent of a physician call in orders for controlled substance for patients for the purposes of weight reduction? No. May anyone other than a licensed MD or DO prescribe controlled substances for weight reduction? So only a doctor of medicine or doctor of osteopathy licensed by the Medical Licensure Commission of Alabama may order, prescribe, dispense, supply, administer, or otherwise distribute a controlled substance in Schedule 3, 4, or 5 to a person for the purpose of weight control, weight loss, weight reduction, or treatment of obesity, except that a physician assistant, certified nurse practitioner, or certified nurse midwife may prescribe Belviq, BELVIQ, or QSMA, QSYMIA, QSMA for such purposes. If a physician assistant, nurse practitioner, or midwife prescribe Belviq or QSMA, the prescriber shall comply with the guidelines and standards of this chapter, which apply to MDs and DOs. May a prescription or order for any controlled substance for a patient for the purpose of weight loss or treatment of obesity be called into the pharmacy? No. Such prescription may not be called into the pharmacy by the physician or agent of a physician. Such prescription may be written or e-prescribed. What is the maximum days supply a physician may prescribe for a weight loss medication? So physicians may only prescribe a maximum of 35 days supply of medication. At the end of that prescription, the patient must be seen by the physician, a physician assistant, a certified registered nurse, and should be evaluated, or a certified nurse and should be evaluated. If medically established goals have been met, the patient may have another prescription for a 35-day supply. Under what circumstances may a patient be eligible for a prescription for a weight loss medication? The patient should have any of the following before being prescribed a weight loss medication. So the patient should have any of the following before being prescribed a weight loss medication: a BMI of 30 or above, a BMI of greater than 25 with at least 1 comorbidity. Male patients, a measured body fat content greater than or equal to 25% TBW. For female, 30% TBW. Male patients, an abdominal girth of at least 40 inches. Female patients, an abdominal girth of at least 35 inches. Under what circumstances may a prescription for weight loss medications be refilled? So after an original prescription for QSMA or Belviq and an office visit for evaluation, the prescription may be refilled up to 5 times in a 6-month period. Refills are specific to brand name drugs, QSMA and Belviq. The refills are not allowed for generic substitutions or for individual prescriptions of phentermine or topiramate. What are some examples of weight loss drugs covered by this policy? There's the 2 we discussed. Their generic names: Belviq is lorcaserin and QSMA is phentermine and topiramate. There's Fastin, which is phentermine, and also phentermine is Apodex, Suprinza. There is also Tenuate, which is dithiopropine. There's Bontril, which is phentermetrazine. There's Lonamin, which is phentermine resin, and Didrex, which is bensphytamine. So those are all of your weight loss drugs covered here. So C2s cannot be used for weight loss. Physicians can only prescribe a maximum of 35 days. Then the patient has to come back. Then the patient may get another 35 days. But there are circumstances where they can be refilled. And that's your 2 brand names, QSMA and Belviq. Refilled up to 5 times in a 6-month period. after an original prescription. So so you have the 35 days, you have the office visit, and you have the 5 times in a 6-month period refill policy. All right, we'll post part 3 shortly.